Hello everyone, myself Dr. Kumar, consultant pediatrician. I am working as senior resident in Department of Pediatrics, PMCH Dhanbad. One of my viewers and many of our students have asked to give a roadmap regarding pediatric history taking and physical examination. So in this video, we are going to deal with that. So what is the purpose of history taking in pediatrics? So the various purposes are to make a diagnosis regarding the illness of the child, to know the complication that may arise due to the illness, and to predict prognosis regarding his illness. Now, what may be the different clinical situations? Number one, the patient or the attendant of the patient come with some illness. Number two situation may be that they may present with parental anxiety and there may not be clear-cut major issue, like sometimes temper tantrum is a case and the child is brought to you for examination. There may be a case of health surveillance. Suppose there is an epidemic or outbreak of measles in certain area. In that case, government agency wants to have a health surveillance regarding the disease. Sometimes attendant also come to cross-check the diagnosis of other clinician or pediatrician. So these are different situations that may bring a pediatric patient to your clinic or hospital. So how to approach the patient? So first of all, whenever you are asked to examine or take a history of the patient, you should stand on the right side of the patient. This is very essential. And before beginning your history and examination, you should introduce yourself and take a proper consent from the attendant or the guardian. And for history, the informant, which in most of the cases are guardians like mother or father, and the history giver should be reliable. Say for example, the child has come to emergency with some passerby or by the school teacher, so they may not be able to give each and every detail regarding the child which you need for your history. Now, what are the points to be taken into account in patient profile? So name, age, sex, religion, guardian's name, income, education, occupation, address, which nowadays mobile number is compulsory, and date of examination, date of admission and date of examination. And in this case, when you collect this data, you should speak in a manner that my patient named Mr. So and so, aged 4 years, Hindu male, son of Mr. and Mrs. Y, uh, who is carpenter by occupation, 10th pass, and he is with annual income of around 10,000 per month. Okay, brought from such and such place with mobile number this, and was admitted on 18th of June and examined on 22nd of June. Okay, so in this way you have to tell this patient profile. Now, presenting complaints, this is the most important point. So in what is the presenting complaint? The complaints with which the child or the patient is brought to you, uh, to your hospital or to your clinic, and this should be in the vernacular language of the patient, which is translated in simple words in English. Okay, and this should be in chronological order, means the symptom which presented first should be mentioned in the first point, then the symptom which presented later should be mentioned in next points. Like say for example, the child complains of cough for 7 days, having fever for 2 days, and breathing difficulty for 1 day. This may be the sequence of the complaint. Then coming to history of presenting illness. So in history of presenting illness, you have to elaborate the points which you mentioned in presenting complaints, and this should be dealt at the points like onset. What was the onset of the symptom? Whether it was insidious in onset or acute in onset or subacute in onset, like that. What is the duration, which I mentioned that for 7 days, 4 days, 5 days, like that. Then how is the progression? Whether the disease is deteriorating or getting better or relieving, like that. And what is the severity of the disease and any complication arising due to the illness, and if any history of treatment received in the past, and if it is there, you have to take the detailed history that what was given. You may not be able to see the document, but they may say that some drugs for fever or cough syrup or antibiotics, like that, was given, and for how much duration, and was treated at which care hospital, primary, secondary, or tertiary care hospital. This should be mentioned. Then you have to mention it regarding aggravating and relieving factors, about the diurnal variation and postural variation. These gets importance in case of cough, that some cough may be aggravated at night, and in case of edema, if it is in the dependent part, then sacral edema will be there in case of lying down position, like that. Then begin when you have collected this information regarding HOPI, you have to say that the child was apparently well till 7 days back or 8 days back, then he developed so and so. Okay, and the aim of the history of presenting illness should be, in the case of symptom review, like we mentioned that cough, fever, like that, so we have to review that. In case of system review, that whether this symptom belong to which system, respiratory system, cardiovascular system, gastrointestinal system, or central nervous system, like that. And any medication received, and that should be mentioned in detail. And last but not the least, you have to mention important negative history, and this negative history have relevance regarding ruling out certain differential diagnosis. So when you are telling a negative history, you should have in mind that I am, by saying this statement, I am ruling out one differential diagnosis. Say for example, you have been assigned a case of rheumatic fever, and you are mm, uh, trying to rule out that this is not a malignancy. So you can say that there is no persistent pain or fever on palpation of the limbs or bones. Then coming to past medical history. So this past history is divided into two parts: past medical history and uh, history of past illnesses. In past medical history, we will deal with birth history in three terms: antenatal, natal, and postnatal. In antenatal, you have to know about number of antenatal visits the mother received during pregnancy, whether she was immunized against tetanus toxoid, and she received iron and folic acid and calcium supplements during antenatal visits, especially in the second trimester of pregnancy. Is there any history of hypertension, preeclampsia, eclampsia, or thyroid disorder, or history of any medications the mother received during pregnancy, with a special emphasis in the first trimester, because first trimester is the period of organogenesis, we all know. Then coming to the natal history, you have to get history whether it was a term pregnancy or preterm pregnancy. Term means 37 completed weeks of pregnancy is term, and less than 37 completed weeks is preterm. Now, what was the mode of delivery? Whether it was vaginal delivery or instrumental delivery or lower segment cesarean section, and what was the place of the delivery. So in place, we want to know whether it was a institutional delivery or it was a home delivery. And if LSCS was done, what was the indications of LSCS? Now once the baby born, we are very much worried to know that whether the baby cried immediately after birth, or some resuscitative measures like need of neonatal resuscitation was there for the respiration. Then history of birth weight and any complications like cyanosis or breathing difficulty or respiratory distress like that. And in postnatal events, whether there was any seizure or jaundice or history of NICU hospitalization, and if it was hospitalized, what was the indication for hospitalization, for how long the baby was there to stay in NICU, and was there oxygen therapy given and for how much duration again, and was there any jaundice in post delivery period, and what was the age at which the baby was discharged from NICU. So these are important points regarding the past medical history. Coming to history of past illness, so in this we want to know, was there any history of hospitalization or major illness, and if so, list in order with dates, name and diagnosis. So say for example the baby may suffer 2 or 3 different kind of illnesses, then you have to uh, tell the names in a chronological order with dates, that in this year this he was diagnosed like that, and with a definite diagnosis. And what was the care of the hospital, whether it was a primary care, secondary care or tertiary care hospital where it was diagnosed. Now any surgical history, significant surgical history, any history of major trauma or bone fracture or any history of head injury, all these things should be uh, included in history of past illness. And then in any history of allergy with drugs or certain kind of foods or asthma or hay fever, these all things should be mentioned in history of past illness. And suppose if there is you have paucity of time and everything, there is nothing relevant, you may escape by saying that his antenatal, natal and postnatal events were uneventful and there is no significant history of past illness. Now coming to the developmental history, age at which different milestones were achieved should be mentioned, and this should be in all 4 domains of development like gross motor, fine motor, social and speech and language. So you can ask regarding social: smile, neck holding, sitting with support, standing with support, then walking, any speech delay, about hearing and vision. These all things should be asked regarding developmental history. And if this becomes more important in case of a cerebral palsy case or any central nervous system case where developmental delay is suspected. So this history should be in more elaborative manner. Otherwise, if it is a elder child more than 7 to 8 years of age and the developmental milestones are normal, so you can ask one single question, ask mother to recall in comparison to other sibling or peer group of the child, that whether all the milestones of development was as per the other sibling or his peer group, or it was delayed. So she may be able to answer you, and in that case, if it is normal, you can say a single sentence that all the developmental milestones were achieved as per age. Then coming to the family history, in family history you have to tell about the mother and father's parental age, then state of health of mother and father, and this history of consanguinity is very much important. Consanguinity means marriage in very close relatives, and this may lead to autosomal recessive type of inheritance in the offspring. So this history is very much important. Then details of mother pregnancy, if it is she is multipara, then other pregnancy list in chronological order with duration and outcome. Why this is important? Because sometimes the loss of pregnancy, recurrent loss of pregnancy, may be a very important clue regarding the illness of this child, and you have to be very cautious for diagnosis and treatment of this child, because this child is precious, because there are history of recurrent loss of pregnancy. Now, is there any history of tuberculosis, diabetes mellitus, or allergy in the family? Is there any history of bleeding diastasis, anemia, or any congenital malformations? Is there any history of rheumatic heart disease, kidney disease, or seizure disorder in the family? Or any history of any genetic or chromosomal disorder, if known, should be mentioned in your history. Then coming to the social history. In social history, we want to know regarding education, occupation, and income of the family. So, and best way is to uh, give a modified Kupuswamy scale, and you should have a printed uh, this chart of different questionnaire that is there, and you have to assign certain points and add all the points, and on the basis of that you may classify the socio-economic status of the family, that may be upper class or upper middle or lower middle, like that. uh, but if the chart is not available with you, you can say regarding the education, occupation, and income, who is the earning member of the family. So you may say father is the only earning member of the family. And the per capita income. Per capita income means the total income of the family divided by number of members in the family. So this is the per capita income of the family, and you have to mention, if mother is the earning member of the family, then who is going to look after the baby when she is at work. And you have to mention housing conditions, and in that, what are the number of rooms, whether the rooms are ventilated or not, and what is the source of drinking water, and what is the way of sanitary practices, that whether they use toilet facility or open air defecation, like that. Then what is the school performance of the child, and how the child behaves with peers and in the family. Are there any smokers or pets and other environmental concern in the family? All these things should be taken into account in social history. So you can say in a summary that mm, father is a 10th class pass. He is a rickshaw puller. His total monthly income is 20,000 per month. Father is the only earning member of the family, and there are 3 rooms, ill ventilated. They use chapakal for drinking water, and they use toilet facility for defecation. Then the child is 7 years old and is go to class 2. He is performing well in the school. He behaves good with his peers and in the family. There are no smokers or pets in the house, like that. Then coming to the feeding history. In feeding, we will start with the birth. So whether the breastfeeding was initiated 1 hour after the birth or it was delayed. Then was this child exclusively breastfed for 6 months? Then what is the age when complementary feeding was started, and with what foods? If the child was not breastfed, what was the other modes of feeding, like whether it was formula fed or some animal milk feed was given, and mode of top feed, whether he was given katori, spoon feed, or gavage feed, like that. Okay. And after that, we have to take proper dietary history, that what is the food intake of the baby before illness, and how is the appetite affected after he gets some illness. Besides that, you have to take the 24 hours dietary recall of the child, like he take 2 biscuits in the morning breakfast, then he eat 2 chapati with dal in the at 10 a.m. Then he eats some rice and curd at the um, um, afternoon session, and then he receives roti and sabji with half glass of milk in the dinner, like that. And with this detail you have to convert it in terms of calorie and protein intake, and then you have to calculate the expected energy or calorie intake as per his birth weight, and the expected protein intake that should be taken by him according to his weight. And then we have to calculate the deficit, that this much calorie of deficit is there or not there, and this much amount of deficit of protein intake is there or not. So these things should be mentioned in the dietary and feeding history. Now coming to the immunization history. So whether this child received various primary and booster immunization as per national immunization schedule or not, and if there were any adverse event following immunization, if yes, then mention. You have to also see the BCG scar on left deltoid area, and the best way is to ask for mother and child protection card, that is routine immunization card. If they have, they will tell you, and you can assure that yes, this child is fully immunized as per age. Then this is the various heading in which we have to take history, and by taking this history we have to give some summary of the history, that what are the positive history leading points that lead to certain diagnosis. And in this case you can use medical terms. So in presenting complaint we do not have to use medical terms, we have to use the vernacular language, but here we can use that with the medical terms, and make a list of differential diagnosis, and this will give you the clue that we should be able to decide which system you want to examine first. Okay, so say for example you are assigned a case of hemolytic anemia. In that case you can present it like that. So this is a case of progressive pallor with weakness which progressed gradually, with history of repeated blood transfusion, with other sibling affected in the family with similar illness. He is also receiving multiple blood transfusion. So uh, 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 most probably this may be a case of hemolytic anemia. You may say like that. So my differential diagnosis are thalassemia major, sickle cell disease, like that. Then now coming to the principles and art of examination of the children. So what are the tools we need for this examination? Number one is a stethoscope, which is very much essential. If you have pediatric stethoscope, it is well and good. Torch, thermometer, percussion hammer, measuring tape, sphygmomanometer. These should be of different sizes, so that for age appropriate cup size should be used for measuring the blood pressure to get a correct result. Then weighing machine. These are things or tools needed for examining a baby. So then regarding the setting, so the room should be well lighted, warm, colorful, comfortable room, and the hand should be warm, because you are going to examine, and if it is a cold season, then the child may not be comfortable with your examination. Now one very important thing which I saw this time during UG examination, that there was a yellow curtain on the window, and the child was assigned a case of neonatal jaundice. and she was asked to examine this case. So in that case, the reflection of yellow color may give a false impression regarding the uh, decision of jaundice in that newborn. So avoid deep yellow or blue curtains, because you have to judge regarding the icterus and cyanosis of the child or baby. So how to approach? So our approach should be gentle, with confidence, with enthusiasm, with patience, with tact and compassion, with concern towards the child, and with kind look and love for the child. This should be the approach of a pediatrician. Now, the cooperation, this is very much needed in case of a pediatric history, because child is very much irritated in some cases of illness. So you have to get a proper cooperation, and for that children should be treated as a children and not as a patient. And you can offer some toy to the toddler before examining, so that you can develop a good rapport with the child. Now, one important thing that we should plan traumatic examination like percussion or throat examination or rectal examination at the end. And here I would like to emphasize that we should also plan to do auscultation if the child is lying or if the child is in the lap of mother comfortably. So you can do auscultation if you are going to take a history of a cardiovascular system, so that before the child becomes irritable or starts crying, you should notice the important auscultatory finding. Okay. Then what is the position of the child in which you should examine? So it is different for different age group. For 0 to 3 months of age, we should examine this child on the examination table. For 3 months to 1 years of age, we should examine this child on the mother's lap. Again, for 1 to 3 years, we should examine in a standing position or on mother's lap. After 3 years, again on examination table. And for adolescent girls, this is a very mandatory thing, that one female attendant or a nurse should be there before you are going to examine a adolescent girl. Then why this examination table before 3 months and after 3 years? Because 3 months to 1 year is the period where stranger anxiety is there in this child. Then coming to the general physical examination. So for general condition, you have to look for attitude, posture, appearance, cry, whether the child is comfortable or not comfortable, or is irritable, like that. So we say like that, my child is conscious, cooperative, oriented with time, person and place if it is a bigger child, and lying comfortably on the bed, or sitting comfortably in the lap of mother, appears sick sometimes, or is crying, like that. Whatever the condition during which you are presenting the case, you can mention. Then whether he appears gravely sick or toxic or restless or dyspneic in case of this respiratory system problems, or dyspneic in case of cardiac problem, orthopneic, or what is the level of consciousness. Sometimes in case of encephalitis, the child may not be oriented well, and any evidence of meningeal irritation. So what are the different signs? Like, is there neck rigidity, is there Brudzinski sign, or is there Kernig sign? These are the different signs of meningeal irritation. Then you have to comment regarding the build and nutrition of the child. So how is the overall skeleton size, how is the body frame, what about the muscle mass, subcutaneous fat, whether he appears to be tall or short, or fat built or thin built, or sometimes the child may be cachectic as in case of malnutrition. So all these things should be mentioned, or the important points. So you can say that he is a tall, good, having good muscle mass, with normal body frame, normal skeleton size, like that. Then coming to the anthropometry. So anthropometry should be in terms of weight, height for more than 2 years of age, and length for less than 2 years of age. Then mid arm circumference in case the child is 1 to 5 years of age. Then you have to measure the head circumference, which is from supraorbital ridge to occipital protuberance. Then chest circumference. Then you have to measure the upper segment and lower segment and body mass index, and you have to mention these in your IAP growth chart, or this should be printed with you. And you have to mention that whether this weight lies in the age appropriate or it is less than 3 percentile or less than 2 or 3 standard deviation, whatever may be the case. And all these parameters should be mentioned, whether they lie in the normal percentile or in the less than 3 percentile, like that, so that you are able to analyze regarding the nutrition of the child. Then regarding the developmental assessment, whether the child development is normal or there is gross developmental delay, means more than two domains of development are affected, or is there is any developmental regression. Then coming to the vital signs, in that we have to measure the temperature with a digital thermometer, and it should be taken in right axilla and for a time till beep of the digital thermometer is there. Then coming to the pulse, and pulse should be mentioned in different headings, like what is the rate, rhythm, character, volume of the pulse, is there any radial or radiofemoral delay, or are all the peripheral pulses palpable or not. So these are the various headings in which you have to describe the pulse. Then coming to the respiration, so the respiratory rate should be counted for complete 1 minute, and you can also mention the type of respiration, whether it is abdominal or abdominothoracic or thoracoabdominal, like that. Then coming to blood pressure, it should be measured with age appropriate cup size, and it should be measured in all the 4 limbs, and you have to mention it in your history. Then oxygen saturation. Now this is 5th vital signs nowadays, and which is measured by pulse oximeter. So you should have to mention that. Then coming to the general features of general examination. So whether pallor, icterus, cyanosis, clubbing, lymphadenopathy or edema is present or not. So you have to mention that. So, and I will try to make a detailed video on each and every general examination in my next videos. So you need to subscribe so that you get that video also. So if suppose this child with thalassemia has come to you, so you can say that there is a pallor present and icterus, cyanosis, clubbing, lymphadenopathy and edema are absent in one line. Okay. Then coming to the head and face examination, so you have to see for head size, shape, any bossing, fontanelles, sutures, or any sign of facial dysmorphism, which may be in the case of Down syndrome. Then regarding eyes, you have to see for is there any ptosis or corneal opacity or evidence of vitamin A deficiency like Biot's spots. Then any cataract or glaucoma, or any proptosis, as in maybe a case of thyrotoxicosis, any squint, or any, then if you have ophthalmoscope, then you have to also see the fundoscopy and tell the finding of fundus examination. We are very much worried regarding signs of raised ICP in case of fundus examination. Then coming to your ENT examination, so ear, nose and throat. So what about the orodental hygiene of your child? How is the teeth, whether there are caries or not, or teeth are erupted properly or not? What is the condition of gums? Is there any ulcer, aphthous ulcer, like that? How is the tongue, whether it is coated tongue? Sometimes This may be in case of typhoid fever. How are the tonsils, whether they are enlarged or not or normal? How is the buccal mucosa overall? Then regarding examination of ears, are there any external otitis externa or any asymmetry or any congenital deformity in ears, like that you have to see. Then condition of nose and throat you have to mention. If they are normal, you can say on ENT examination the child is normal. You can say like that if everything you think that on examination is normal. Then coming to examination of the neck. So in neck we see the hairline, which sometimes becomes important in case of this Turner syndrome in female child. Then waving may be there in some children. Then regarding jugular venous pulse, you have to see. Then arterial and venous, is there any visible arterial or venous pulsation? You have to mention in neck. Then coming to skin and its appendages. So regarding skin, where the color, the texture, the turgor, elasticity, and is there any skin rash on the body? These things should be mentioned in your skin and appendages. Then regarding hairs, the distribution of hairs, their color, their texture, is there extra hairs on the face, like in case of hirsutism. So this distribution and color of hairs become very much important if you are going to take history of a uh, protein in energy malnutrition case. In that case, we found flag sign, means alternate graying of hairs may be visible. Then coming to nails, very much important. Clubbing gives clue to various systemic diseases like cyanotic heart diseases or liver diseases or subacute bacterial endocarditis, some lung abscess, like that in case of pediatrics. Then flattening or koilonychia. This koilonychia is again an important pointer of iron deficiency anemia. Then splinter hemorrhage. This is an important pointer in case of infective endocarditis. So these small points you have to examine, and if any abnormality you have to mention in your case. Then overall you have to look for any evidence of vitamins and mineral deficiency, like Bitters spot in case of vitamin A deficiency, rachitic rosary in case of vitamin D deficiency, any swelling or deformity in the hands in case of vitamin D deficiency, or signs of scurvy in case of vitamin C deficiency, like that all you have to mention. Then coming to bones and joints, are there any deformities of long bones or thorax, like kyphosis or scoliosis and spine? Any deformity in hands, feet, or any signs of rickets, you have to mention in your history. Then coming to the genital and sexual maturity, so whether the genitals are normal or there is presence of ambiguous genitalia, that we have to mention. Is there any hernia, visible swelling in scrotal area? Is there is a congenital or any hydrocele? Then what are the conditions of testis, whether they are descended or undescended? Is there balanitis in the genitals, or the prepuce skin is very tight, which may be painful during for the child? So all these things should be mentioned in your history. Then coming to the systemic examination. So that systemic examination should be done in 4 headings, that is inspection, palpation, percussion and auscultation. So this inspection should be done without touching your child. So, and the every finding should be mentioned, that it appears to be like you are inspecting the trachea, so you may say that trachea appears to be central in position. Like that, in case of examination of a abdomen, you can say that the abdomen appears to be distended. The umbilicus appears to be laughing umbilicus, like that. These are the findings of inspection. Then coming to palpation, the palpation again may be superficial or deep, and it depends upon the findings depends upon system to system, and the findings of inspection are confirmed in palpation. So we will discuss these things in detail in various systems history. Then coming to the percussion, so the percussion may not be important in all systems. Like in CNS, we have very few chances of percussion, only in case of crackpot sound, like that you need percussion. Then coming to auscultation, so again this auscultation may not be important here in examination of every system, but this becomes very much important in case of cardiovascular system and respiratory system, because you have to auscultate the heart sound, the quality, uh, whether both heart sounds are audible or not, any adventitious sounds is audible or not, what is the type of murmur, whether it is systolic or diastolic, and duration, accentuation, like that. All these things should be described in detail in case of auscultation of cardiovascular system. So this all these systemic examinations should be done for chest, cardiovascular system, for abdomen examination, and examination of the central nervous system. So we have to take this systemic examination in great detail. And one thing is important here, that by take history, you should be able to decide that which system I am going to examining the first, because by this time you should have an idea that this may be a case of this system, so I would like to examine this system first. And if the examination of other systems are normal, then you may say that suppose you are presenting a case of hemolytic anemia, so you can say that on per abdomen examination there is hepatosplenomegaly or splenohepatomegaly, and examination of chest, cardiovascular system, and central nervous system, and genitourinary system are within normal limit. You can say like that. Then with all this history, now you have to reach at a probable diagnosis. So this probable diagnosis should be made on the basis of anatomical diagnosis, that which system, and in that which part of the system microanatomical diagnosis should be made. Then what is the pathology involved, whether it is pneumonia, whether it is uh, any trauma, whether like that. Then what is the etiological diagnosis? Is, is it infective, infiltrative, or malignancy, like that? And are there any complication present or not? Say for example, you are going to present a case of cardiovascular system like TUF, then you may say that this is a case of congenital cyanotic heart disease, most probably tetralogy of Fallot, without any signs of congestive cardiac failure, without any signs of infective endocarditis, and in normal sinus rhythm. So this may be a complete probable diagnosis of a case of tetralogy of Fallot. And we will discuss these things in detail when we will deal with a case of systemic during our case series of different systems. So I think this is in nutshell regarding the roadmap of pediatric history taking. This may not be the complete setup, but it will give you overview how to proceed regarding history taking in the case of a pediatric case. So I think this video will be helpful for you to take a proper history, and if it adds value to you, or do you need any clarification from my side, then comment below, and tell me on what next topic you want to discuss with me. I will be always there to help you. If you like the video, please share and subscribe so that you get early notification of my this kind of video. Thank you. Thanks very much for watching this video.